Female genital organs. Female genital organs subdivide on internal female sexual organs, ovaries, uterine tubes, uterus and vagina. External female genital organs, pudendal area with labia pudenda majora and labia pudenda minora, vestibule of vagina, clitoris and mons pubis. The ovary is a pair organ, is situated in cavity of lesser pelvis. It has medial surface and lateral surface, free margin and mesenteric margin, uterine extremity and tuberous extremity. Ovary is situated in peritoneal cavity. It is covered by embryonic epithelium, not by peritoneum. Ovary attaches to uterus by proper ovaric ligament, and to pelvis walls by the medium of suspensory ovaric ligament. Ovaric mesentery approaches to anterior margin, through which the vessels and nerves get into ovary hilus. Ovary parenchyma consists of cortex and medulla. Ovule ripens in cortex, where primary folliculi are situated, which then transforms into graft vesicle. After that, as vesicle blows up, an oocyte gets out from the ovary and gets into uterine tube. Vesicle becomes as corpus luteum, yellow body. If there is not fecundation, then corpus luteum transform into corpus albicans. In case of fecundation, corpus luteum grows up and turns into corpus luteum verum, which functions during pregnancy. The uterine tube is a pair organ, is situated in area of superior margin of ligamentum lautium uteri. Length of each tube is 8 to 18 centimeters. There are 4 parts. Uterine part runs in wall of uterus and opens into uterine cavity by uterine ostium. Isthmus of uterine tube lies closely to uterus. Ampulla of uterine tube is greater part of uterine tube. Infundibulum of uterine tube is broadened part, which opens by abdominal foramen of uterine tube into abdominal, peritoneal cavity and is covered by fimbria, one of which, ovaric fimbria, is longer than other. Uterine tube is covered from all sides by peritoneum and has its own mesentery. Tube has also muscular membrane, longitudinal and circular layers, and mucous membrane. Uterine tube normally, then fertilized ovule passes into uterus. The uterus is an odd hollow organ, pear-shaped object, which is situated in cavity of lesser pelvis. It has a fundus, body and neck of uterus, which opens into vagina by uterine ostium, limited by anterior labium and posterior labium. Uterine neck is divided into supravaginal portion and vaginal portion. Uterine body has vesicle surface anterior and intestinal surface posterior. Place of transition body of uterus into neck is called as isthmus. Anterior uterus surface adjoins to urinary bladder and posterior to rectum. Attached to empty urinary bladder, body of uterus is tilted forward. Also between body and uterus, neck forms an angle, open forward. Such position is called anteflexio. Attached to full urinary bladder, Hindus and uterus body displaces posteriorly. This is retrovisio. Triangle-shaped cavity of uterus above communicate with uterine tubes and vagina through the cervical canal and ostium uteri. Cervical canal and ostium uteri. Wall of uterus consists of 3 layers: mucous membrane, endometrium, submucous stratum is absent, so there is no folds on internal surface of uterus. Muscular membrane, myometrium, is formed by smooth muscle and consists of internal, middle and external layers. Serous membrane, perimetrium, is a peritoneum, which covers an uterus from all sides, except part of front surface and lateral margins, and supravaginal portion of neck, mesoperitoneal position. Serous membrane forms ligamentum uteri lautium, which forms mesentery of uterus, mesentery of ovary and mesentery of uterine tube. Between sheets of ligamentum lautium uteri the vessels, nerves, adipose tissue, perimetrium, and ligamentum teres uteri are contained. Ligamentum teres, round uteri, passes through the inguinal canal to pubis. Also uterus is fixed to pelvic walls by cardinal ligament. The vagina is a tube of 7 to 9 centimeters in length that communicates uterine cavity with external genital organs. Upper portion of vaginae envelopes the uterine neck-forming vaginal fornix. Vagina has anterior and posterior walls and opens by orifice into vestibule. Fold of mucous membrane hymen closes this orifice in virgins. After defloration, remainders of hymen called caruncle. Internal mucous membrane contains columnar rugarum that located along the walls of vagina. Middle coat of vagina muscular, external 1, connective tissue.